So, Drew, we had a little bit of time now to go over this very detailed bill. It's a specific bill they put forward. Where are the differences from Obamacare? Is it really a repeal?
Yes, it is. I mean, it's a repeal in a lot of ways, and in other ways, there are aspects of it that are going to look similar. There are still, for example, some tax subsidies to help people buy coverage, go out and buy insurance coverage. The difference is that for a lot of folks, they're going to get a lot smaller. In particular, if you make, near the poverty level or just a little bit above, and you're relatively young, the subsidy you're going to get is probably enough to buy you maybe a plan with a really high deductible that offers some catastrophic coverage. You don't get the same kind of generous subsidies for lower income people that you had under Obamacare. On the other hand, as you get up into higher income levels, those folks tend to do a little bit better. And so, we're going to see some of the effects here. It's going to matter for the insurance industry just in terms of who their customers are. And then it'll also matter for the hospital industry in terms of, what kind of coverage are the folks who come into their emergency rooms and hospitals having. It might not necessarily be the best news for them, given that you're going to see people who are going to have a little bit more trouble paying the front end of their bills when they show up.
So let's start with the insurance industry. As you said, one of the real benefits for the insurance companies of Obamacare was a lot more people came into insurance plans. Now, some insurance companies have backed off of that since. Under this plan, as far as we understand it, would those people stay in insurance, or are the insurance companies going to lose a lot of customers?
It's hard to know. And one of the reasons is that for right now, we actually don't have what's known as a CBO score. That's the Congressional Budget Office. They're the kind of nonpartisan actuaries that, anytime there's a piece of major legislation, they say, how much is it going to cost taxpayers? And in the case of an insurance bill like this, how many people are going to get covered or lose coverage? So I think one of the expectations here is that there's going to be some people who, decide not to buy coverage because there's no longer a mandate. There would no longer be a mandate under what Republicans are proposing that people have to have coverage. That said, there's also some penalties for not having coverage. There's basically, if you lose coverage and you drop it, you have to buy it again. What Republicans are saying you should have is a 30% penalty on your premiums for the next year. It's another penalty. What it does in terms of actually incentivizing people to go out and buy coverage and maintain their health insurance coverage, I think we have yet to see. It may not be the strongest penalty out there.
Do we have reaction from the insurance industry yet?
What they basically said is that they're still looking at it. I think anytime you have something like this where 100 some pages of legislation, it hasn't even been scored by CBO. You're waiting to see exactly where this thing shakes out. And Trump tweeted this morning. He said this bill is open for negotiation. So I think if you're industry and you're looking at this, you're saying, okay, this is a starting point. The House Republicans are one small fraction of the legislative process here. They've got to get members of the conservative caucuses on board. It's going to have to go through the Senate, where Republicans have a pretty razor-thin margin of only about they can only lose 2 votes basically, and then you're going to have to deal with all the asks that industry is going to have as well. So this is the very, very, very start of what is going to be a long process, both politically and from an industry standpoint.
Yeah, it may be open negotiation, but as we just showed in the tweet from the president, he did call it a wonderful bill. So that indicates some endorsement of what's going on here as a practical matter. What about some of the people who are not going to be taxed as much, like hospitals and things? So with a lot of Obamacare taxes in the healthcare industry, are those industries going to benefit?
They will to a degree. I mean, the taxes on industry were not insubstantial, but they weren't necessarily difference makers on how they were doing business. There were taxes on health insurers, on pharma companies, on medical device makers. A lot of that stuff they're proposing is going away. One thing that is not going away is what's called the Cadillac tax. That's a tax on high-cost insurance plans that Republicans hated and the industry didn't love either. That's only being delayed, which will be very interesting to see if that survives the negotiating process. It's going to be delayed until 2025, which is kind of a long time enough to kick the can down the road and keep negotiating that. But some of these things are staying in place. And we haven't necessarily seen exactly, we need to see a CBO score before we can know, is this thing all balanced from a budget perspective?
So very briefly, Drew, what's going to determine whether this gets done quickly? Is it the conservative Republicans of the House?
Yes, I think so. I mean, the House, that's the first step that they need to pass. You can't do anything without the conservatives. It's a huge block in the House. Democrats are not going to help them. Right. That gets you to point 1. After that, it's the Senate, and good luck there. Right.